All right, today we're going to play medical detective. We're diving deep into a mystery where the crime scene, well, it's the human body itself.
So how do you find a problem you can't see? It's the ultimate investigator's challenge, right? Only we're not talking about some dusty crime scene. The clues are buried, the bad guy is microscopic, and the stakes, they could not be higher.
For doctors, this mystery is all too common. It's an infection hiding deep inside our bones. And for the radiologists, think of them as the forensic investigators of medicine. This is their daily grind. So let's follow the evidence and see how they crack the case.
Okay, first things first. Let's get to know the villain of our story. This is the hidden enemy we're hunting down.
The technical name for this is osteomyelitis. And let me tell you, this thing is a master of disguise. Seriously, it can look like anything, pop up anywhere in the body, and it doesn't care if you're a baby or 100 years old. That's what makes it so tough to pin down. And what's really interesting is how its method of attack can change depending on your age. In kids, the infection usually hitches a ride through the bloodstream. Doctors call this hematogenous spread and sets up shop in the long bones, where all the growth is happening. But in adults, it's often a different story. It might be a direct invasion, say from an ulcer if you're diabetic, or it can also travel through the blood, which is pretty common in IV drug users. So right away, who the patient is gives you your very first clue. All right, so you've got a suspect. Now what? Well, every detective needs their toolkit, right? It's time to bring out the high-tech gear that lets us see what's going on deep inside. And there's a standard operating procedure here. It all starts with a suspicion, like, say, a foot ulcer that just won't heal. Step one is always the most basic tool, the X-ray. If the X-ray comes up empty, then they bring in the big guns, the MRI. But here's where our detective story gets its first major twist. You can have a full-blown infection raging inside a bone for a week, maybe even 10 days, and the X-ray, it can look completely normal. Nothing. The enemy is there, but it's totally invisible to our first piece of equipment. So this really shows you why you need both tools. Think of the X-ray as your scout. If it spots something obvious, like the bone being eaten away, great, case closed. But when that scout comes back and says, I got nothing, that's when you send in the specialist, the MRI. It's just so much more sensitive. It can pick up on all those tiny, subtle clues the X-ray just sails right past.
So what exactly is the MRI looking for? It's looking for a very specific pattern. On one kind of image, called a T2 or STIR, the infected area just lights up like a Christmas tree. That's a super sensitive sign that something's wrong. Then you look at another kind of image, the T1, and the healthy bone marrow, which should be bright, is dark. When you see that combination, boom, that's the smoking gun. It's the imaging equivalent of finding the bad guy's fingerprints all over the crime scene.
Okay, so we've got our super tool, the MRI. But now we have to learn how to speak its language. You see, an MRI doesn't just flash a big sign that says infection here. It tells a story with pictures, and you got to know the lingo to understand it.
First word in our new vocabulary, Sequestrum. This is a classic sign of a chronic, long-term infection. Basically, it's a chunk of dead bone that the infection has killed off. It gets walled off by all this inflamed tissue. Finding one of these is a huge clue.
And check this out. The body does something pretty incredible when it finds a sequestrum. It tries to quarantine it. It literally builds a wall of new bone all the way around it. That bony wall is called an involucrum. It's like the body's own little containment field. But the infection doesn't just give up. It fights back. It punches an escape hatch through that new bone wall so it can drain out all the nasty stuff, like pus. This little channel is called a cloaca. So when a radiologist sees that trifecta, the dead bone, the new wall around it, and the escape hatch, the case is pretty much solved. It's chronic osteomyelitis, for sure.
Okay, you guys ready for an advanced level clue? This one has a super cool, kind of spooky name that actually makes perfect sense once you hear what it is.
It's called the ghost sign, and it is such a great clue. Here's how it works. On that T1 image we talked about, the infected bone kind of disappears. It gets all blurry and loses its edges, just like a ghost. But then you switch over to the T2 image, and bam, it reappears, all sharp and clear again. That little now you see it, now you don't act is a massive pointer towards osteomyelitis.
Now, any good detective will tell you that context is everything. The clues don't mean much on their own. So now that we can read the images, it's time to start profiling. We're going to connect the what and the where to the who.
For experienced radiologists, this becomes a kind of word association game. It's like, you say this, I say that. You see an infection in the spine, or just one side of the SI joint, you immediately think of an IV drug user. You see a huge abscess in the psoas muscle. The #1 suspect is tuberculosis, or TB. These patterns are like mental shortcuts that are just crucial for getting to the right answer fast.
And even in the same spot, like the spine, the story is different depending on your age. In an adult, the infection usually starts in the bone and then busts through into the disc. But in little kids, it's often the other way around. They actually have blood vessels that go right into the disc. So for them, the infection can start there and then spread to the bone.
And that brings us to our last suspect. This one is a special case. It's an ancient disease that plays by its own set of rules and leaves behind a very unique and often destructive signature.
Yeah, tuberculosis. It has a totally different MO, a different modus operandi. You really have to know its specific calling cards to catch it.
And here they are. These are the telltale signs of TB in the spine, which is also called Pott disease. First off, unlike almost every other infection, it leaves the discs alone until way late in the game. It also likes to skip around, so it might infect one bone in the spine, skip the next one, and hit the one after that. And the really dramatic sign, it can cause so much damage that the spine actually collapses forward, creating this really sharp angular hump. That has a name. It's called a gibbous deformity. When you see that, you're almost certainly looking at TB.
When you think about it, from a faint shadow on an X-ray to the ghost of a bone on an MRI, what these medical detectives are doing is reading a secret language, a language written by the body itself. It just goes to show you that every medical image is a mystery, just waiting for a detective to crack the case. What other mysteries are waiting to be solved?